Good day, and welcome to Infection Navigator. Today is June 1, 2025, and we take you on a deep, thoughtful journey through the most important and emerging developments in global infectious disease news. In an interconnected world where health threats ripple across borders and societies, understanding the latest events is essential not just for public health officials but for every one of us. We begin in Africa, where mpox cases are climbing at an alarming rate. Malawi recently reported additional confirmed cases in the capital city of Lilongwe, contributing to a wider regional surge across 16 African nations. Since the beginning of 2025, more than 52,000 mpox cases and over 1,700 deaths have been reported. Healthcare systems are straining under the pressure, made worse by reduced international aid that has particularly affected HIV treatment programs. One of the most critical challenges is the lack of vaccines. While Africa needs an estimated 6.4 million doses, only about 1.3 million have been received so far. Public awareness remains troublingly low, drawing parallels to the early months of the COVID-19 pandemic when slow responses allowed the virus to spread unchecked. Shifting to the United States, the country is currently facing a serious measles outbreak, with confirmed cases surpassing 1,000. The hardest hit area is West Texas, specifically Gaines County, where the majority of cases have occurred, resulting in dozens of hospitalizations and 2 reported deaths among unvaccinated children. Other states such as Kansas, New Mexico, and Ohio are also witnessing case numbers rise. Experts link the resurgence to falling vaccination rates and increased international travel, underscoring the ongoing importance of maintaining robust immunization programs to safeguard communities from preventable diseases. COVID-19, though no longer classified as a pandemic, remains a persistent presence in our daily lives, much like seasonal influenza. Recent weeks have seen a notable uptick in global test positivity rates, climbing to 11% in mid-May, a figure reminiscent of peak periods from the previous year. This increase is largely driven by regions in the Eastern Mediterranean, Southeast Asia, and the Western Pacific. While the dominant variants appear to be less severe than earlier strains, scientists caution that we cannot become complacent. Continued monitoring and the adaptation of vaccines to cover new mutations are vital to maintaining control over the virus and protecting vulnerable populations. In Australia, the state of Queensland is grappling with an intense whooping cough outbreak. Since January, more than 2,300 cases have been recorded, over 3 times the usual annual average. The rise has been linked to both declining vaccination coverage and a relaxation of public health practices that were once common during the COVID-19 era. Infants and pregnant women are especially vulnerable to complications, which can include severe respiratory issues and, in rare cases, brain damage. Public health authorities are calling for renewed vaccination efforts and the reintroduction of preventive behaviors, such as minimizing exposure and practicing good hygiene, to reduce transmission rates. In the realm of scientific discovery, a striking new study has emerged from the pages of BMJ Open, where researchers analyzed the connection between herpes simplex virus type 1, HSV1, commonly known for causing cold sores, and an increased risk of Alzheimer's disease. Drawing from data on over 344,000 individuals, the study revealed that those with a history of HSV1 infections were more likely to develop Alzheimer's later in life. Interestingly, the use of antiviral medications such as acyclovir, valacyclovir, or famciclovir was associated with a significant reduction, about 17%, in the likelihood of developing the disease. This finding opens new avenues for potential preventative strategies and underscores the importance of long-term infectious disease research in understanding chronic neurological conditions. Meanwhile, concerns over avian influenza, particularly the H5N1 strain, continue to rise. A recent case in Nevada marked the first recorded human infection with a new sub-strain, D1.1. The infected individual, a dairy worker, experienced mild symptoms and has since recovered, but the case has raised red flags among epidemiologists. The potential for cow-to-human transmission raises the possibility that this strain could become endemic within the United States, a scenario that would demand heightened surveillance and enhanced biosecurity measures, particularly for those working in poultry and dairy industries. Another looming global threat is the resurgence of yellow fever, a mosquito-borne viral disease. Parts of Africa are witnessing a troubling rise in cases, fueled by insufficient vaccination coverage and weak mosquito control efforts. Scientists warn that the densely populated Asia-Pacific region is particularly vulnerable should the virus spread beyond its current range, especially given the volume of global travel and trade. Despite the existence of a highly effective vaccine that offers lifelong protection, limited supplies pose a major bottleneck. Urgent international action is needed to boost vaccine production and strengthen vector control programs to prevent yellow fever from becoming the next global health emergency. As we reflect on these developments, one truth remains clear: the fight against infectious diseases is far from over. It is a complex, ongoing battle that demands vigilance, investment, and cooperation across nations and disciplines. Public health experts, scientists, policymakers, and individuals all play a role in shaping our collective response. Whether through supporting vaccination efforts, advocating for science-based policies, or simply staying informed, each of us contributes to the resilience of our global health systems. Thank you for joining us today on Infection Navigator. We invite you to stay tuned for further updates and to continue following the evolving landscape of infectious disease with us. Together, by staying informed and engaged, we help build a safer, healthier world for all. Stay safe, stay informed, and we'll see you next time.